Friends, today I'm going to talk on very deadly disease of pancreatic cancer. In among the all cancer, the pancreatic cancer is not that much common like a breast, lungs, and prostate cancer, but the survival and death rate is very highest among the all GI cancer because pancreatic cancer patients usually came to the hospital very late, advanced disease. So very few patients get a curative treatment. So today's our intention to talk is to how to diagnose the early pancreatic cancer and how to manage the cancer. So the symptomatically there are some precancerous condition also like an hereditary pancreatic cancer, those come into the family. Chronic pancreatitis also very likely to develop pancreatic cancer. सिस्टिक लेजियन ऑफ पेंक्रियास उसमें भी पेंक्रियाटिक कैंसर होते हैं. तो दिस वी कैन डायग्नोज बाय डूइंग सिंपल सोनोग्राफी, CT scan, MRI and endosonography. These are the commonly performed tests to diagnose pancreatic cancer. So this gives the diagnosis of pancreatic cancer. This gives the sample for histopathological examinations, and this also investigation says that this tumor is resectable, means disease is curable or not. If curable disease is there, then the surgery we can proceed for surgery, and non-curable disease, there are palliative treatment is available. So how this patient presents, pancreatic cancer presents very ambiguous pain, very non-specific symptoms like epigastric pain, fullness, backache, and weight loss. So this patient wandering from this general practitioner to practitioner without diagnosis, and when they came to the specialist and diagnosis done, there will be an advanced pancreatic cancer. Very few very ampullary pancreatic cancers, they present with the early jaundice. So the periampullary tumor produce compression of the bile duct and produce jaundice. So these patients came to the hospitals very early for the diagnosis, and due to the jaundice, we can come to the diagnosis of pancreatic cancer, and this early disease will give good results. So the diagnosis is done by US, MRCP, CT scan. So they say the staging of the disease, it is an advanced stage or early stage. It is operable or inoperable, and there may be many times it is a borderline inoperable, means is directly in the front, it is not operable, but after making some neoadjuvant treatment we can make it operable. So the classical operation for the treatment of pancreatic cancer is a Whipple's operation, very risky operation, big operation, but that is the only surgery that can cure the disease. And if tumor is in body and tail part of the pancreas, then the distal pancreatectomy is an option for the surgery. So if surgery is possible or curable and patient is fit to tolerate major surgery, then we have to go for the surgery. No doubt, all of you know that surgery, this pancreatic cancer surgery, Whipple surgery is known for this morbidity and occasionally mortality. But we have to, the experience center, large volume center, having a very good outcome of this pancreatic cancer surgery. So, after surgery also patient needs a follow-up for a long period, 6 monthly CT scan and tumor markers, and there will be a recurrence, then we have to manage the palliative care of treatment. So those patients who are not curable, then we have to manage the palliative treatment. So main two symptoms is there, one is jaundice and one is pain. For the jaundice, self-expandable metal stent we can put into the bile duct and jaundice will be relieved, and it works for a long time. 6 to 9 months stent will work, and there will be a patency of the bile duct through the stent. And pain is a predominating factor in the body and tail of pancreas. Then we can give an analgesic, oral analgesic, not relief, then we can go with injectable analgesic or this buprenorphine patch, fentanyl patch, and we can give an endosonographically celiac axis block. So these are the palliative treatment we can offer to the patients, and those patients are cured with the surgery, we can ask them the regular follow-up to see for the prevention recurrence of the tumor. So this is a diagnosis and management of the pancreatic cancer. Now, how can we prevent pancreatic cancer? So there are some precancerous conditions and some disease that the chances of pancreatic cancer is more. So these patients, we put them surveillance for examinations by endosonography, CT scan of the pancreas, and if we have any suspicion, we took a biopsy, and biopsy turned out to be a positive, then we will go for the surgery and resection of the pancreatic cancer. So the important message is, if you have any vague symptom pertaining to the upper abdomen like an acidity, epigastric pain, backache, then keep in mind and investigate for the pancreatic cancer. And if you have pancreatic cancer and if it is operable, then best way to get rid of the pancreatic cancer is an experienced surgeon. Those who have a large volume of surgery of pancreatic cancer in a year, they have a good outcome. So friend, and other than the precancerous, those become disease that have chances to turn into the pancreatic cancer, we have to be very watchful, and we have to serial investigations of this patient. If this type of patient with CT scan and tumor markers is good to prevent or to diagnose early pancreatic cancer. Because in advanced pancreatic cancer, we cannot do a treatment for the treatment, but palliative is a treatment that gives the patient's pain relief. Thank you very much for kind attention and patience hearing.